Hello everyone, my name is Deepti Parmar. Today we will learn about the community health nursing subject. In that we will see the unit 5 epidemiology and nursing management of non-communicable diseases. In that first we will see about the introduction. What is the NCD? So NCD is also known as chronic disease, tends to be of long duration and are the result of a combination of genetical, physiological, environmental and behavioral factors. Means what is the meaning of communicable disease? So communicable disease is also known as the chronic disease, and it is mainly caused by not only one factor. It leads from several factors like genetical, physiological, environmental, and behavioral, and it tends for a long period. So, and we diagnose the non-communicable disease after a long period also. Then the main type of non-communicable disease are cardiovascular disease like heart attack and strokes, cancers, chronic respiratory disease such as chronic obstructive pulmonary disease and asthma and diabetes. So these are the diseases which we can include into the non-communicable disease. Now, what is the definition of non-communicable disease? So the Commission of Chronic Illness in USA has defined chronic disease as comprising all impairment or deviation from normal which have one or more of the following characteristics. So, non-communicable diseases are mainly defined as the that disease which have the this following characteristics. So in that first is a that diseases are permanent. So non-communicable diseases are not curable. We can control the symptoms, but we cannot cure that disease. Then leave residual disability. So if any person is suffering from any type of non-communicable disease like hypertension or diabetes, so it also the person is also at risk to produce any type of disability. Then are caused by non-reversible pathological alteration. Mainly non-communicable diseases are caused by the alteration in the pathology of the body. Okay, then require special training of the patient for rehabilitation. So what is the meaning of rehabilitation? Rehabilitation means we cannot cure that disease, but we can control it. So rehabilitation means the care which is provided to the person for controlling controlling some symptoms. So in the non-communicable disease all the patients need rehabilitation. So for rehabilitation we give them that type of care which care can control their disabilities or symptoms. May be expected to require a long period of supervision, observation, or care. Like if any person is suffering from hypertension or diabetes, so we cannot give them medication and just say them that yeah, you will come after 4 or 5 months. We just they that patient need continuous supervision. Like we have to check or assess blood pressure at the regular interval, like after 2 to 3 days. So the non-communicable disease are diseases which need a particular attention, or we have to supervise that disease continuously. Then in that first we will see about the cardiovascular diseases. In that coronary heart disease and ischemic heart disease. So it is impairment of function of heart due to inadequate blood flow to the myocardium as a result of the in obstruction in the coronary circulation. Mainly what will happen in the coronary heart disease or ischemic heart disease, mainly which is the normal blood flow will be altered in this disease. What will happen that uh, myocardium cannot get adequate blood due to alteration into the coronary circulation. And why this happen? Because there is a obstruction into the coronary artery. So this is the main cause of this disease, that obstruction will occur into the coronary artery, and due to the normal blood flow will be altered, and due to that heart cannot get adequate blood, and that function of heart also will be affected. Then the disease is produced from the blockage of lumen of the coronary artery. As I said, that mainly this disease is caused by the blockage of the coronary artery. Means atherosclerosis is produced into the coronary artery. So, coronary artery disease is manifested as, so there are certain disease which also included into the coronary artery. So in that, angina pectoris, then myocardial infarction, irregularities of heart, cardiac failure, and cardiac arrest. These all are diseases which manifestation of the coronary artery diseases. Then what are the predisposing factor of the non-communicable disease or coronary artery diseases? So predisposing factors means the risk factor. So in that, predisposing factor mainly classified into the two categories: non-modifiable and modifiable. First we will see about the non-modifiable. Means we cannot modify that factors like age, sex, family history, or genetic factors. So we cannot modify it. And the second is the modifiable factor. Means we can change it, like cigarette smoking, then hypertension, serum cholesterol, serum homocysteine, diabetes mellitus. So if person can take care of their self, or a person can consult the doctor, so the factors will be modified. Or if person get adequate care from their family, so also that factors can be modified, like cigarette smoking. So uh, uh, person cannot if person do not smoke, so by the effects which will be occur by the cigarette smoking, that can be uh, decreases. Then hypertension, then serum cholesterol. If person is mainly focus on their diet, and reducing the diet, avoid that diet which has a high cholesterol level, so also the cholesterol level will be maintained. And as the cholesterol, there is also homocysteine which damage the artery. So level of homocysteine also managed by the uh, balanced diet. Then diabetes mellitus. Okay, so if person is avoid the sugary diet, or avoid the glucose rich food, so it can be also modifiable. Then obesity. Means if person is having sedentary lifestyle, so they have higher chances to producing non-communicable disease or coronary artery disease. But they focus and they do the physical activities and exercises, so that can be also modifiable. Then exercise, then hormone, like hyperestrogenemia favors the development of coronary arteries. Example given: oral contraceptive pill, like some women taking some type of pills, like contraceptive pills. So these contraceptive pills also may develop the also may helpful to develop into the coronary artery disease. Then type A personality, like competitive, restlessness, impatience, irritability, short temper, sense of urgency. These type of person are also has a higher risk to produce the coronary artery disease than the person who are consuming alcohol in a very high amount, then soft water, like high among those consuming soft water than those consuming hard water. Means hard water containing the minerals and soft water containing not adequate minerals. So minerals also doing controlling also helpful in controlling the coronary artery disease. But person those who are consuming the soft water, so they have chances to, or they are at risk to producing the coronary artery disease. Then noise, chronic exposure to noise over 110 dB increases serum cholesterol level and thus the rise of coronary artery disease. Excessive noise also can develop the coronary artery disease. Then drugs, misuse of fenfluramine and phenytolamine used for reduction of weight can be damaging to the heart. Okay, so there are several drugs, not only these two drugs, but there are several drugs which also helpful to producing the coronary artery disease. So person should avoid that drugs also. Then how we can prevent the coronary artery disease? So there are mainly three levels of prevention: primordial, primary, and secondary. Also there is tertiary prevention is there. So in that primordial prevention means we should control the risk factors. Okay, so how we can do the primordial prevention? So in that, this prevention directed towards discouraging the children from adopting harmful lifestyle such as smoking, eating pattern, physical exercise, alcoholism, etc. Like these all are the risk factors. So we we have to advise the children, or we have to advise the young adults, young people or adults, that they do not use the smoking and they avoid the alcohol, and their eating pattern should be changed. So by doing that they can prevent the risk factor. So the main intervention is through mass education. And how we can do that, how we can educate them? Then we use the mass education or media. We also use mass media, and we educate them about the these certain factors which we can modify. Then what is primary prevention? So in that, this consists of elimination of modification of risk factor of disease, which the following approach. So mainly in the primary prevention there are two strategy. First is a population strategy and second is the high risk strategy. As per the name, population strategy means we have to follow it into the whole population. And high risk strategy means we just only focus or target to the person, to population which are at the high risk. So first is a population strategy. In that, dietary changes. So how we can educate them, what advice we should give them? So we advise them regarding the dietary changes, then smoking changes. Then we also advise them about blood pressure. What are the sign and symptoms of the blood pressure? When blood pressure is increased, what are the sign symptoms when blood pressure will decrease? Okay, so we can educate the people regarding this. And also we should advise them regarding the physical activities, like they should start the walking. If they have sedentary lifestyle, so they have to do some physical activity which can burn their calorie. And we also advise them regarding the diet, like which diet they should take in for preventing the non-communicable disease or coronary artery disease. Then what is the high risk strategy? Means, as I said, that we have to target the particular population, like population which are at the highest risk. Like this consists of identifying the at-risk group person for coronary artery disease and providing preventive care. Like if we are giving we if we are giving education or care regarding the coronary artery disease, so we have to target that type of population which are at the highest risk of producing the coronary artery disease, and we providing the preventive care. Then individual with hypertension are given treatment. If any person is suffering from hypertension, so we give them treatment like for preventing to uh, hypertension in converting into the chronic disease. And smokers to give up smoking. We also advise the smokers for do not smoking, and person with hyperlipidemia are treated. If any person is having lipid level is very high, so we also treat it. Second, secondary prevention. So in the secondary prevention, here prevention of reoccurrence of coronary artery disease by cessation of smoking, regularly taking tablets is the focus. So what is the focus on we have to do into the secondary prevention? So we just focus on to the prevention of a reoccurrence means if any person has controlled their diabetes, or sorry, if any person has control on their hypertension, or if his or her blood pressure should be controlled, so we have to keep in mind that we have to focus on that this control should not be altered, or the disease will not reoccur. Okay, so how we can do that we just advise them that they do not smoking if they are smokers, so we advise them that please don't smoking. Then regularly taking the tablets. If any person is having taking medicine, so we advise them that this medicine continued till doctor do not advise to them stop.